Chapter 14, Early Childhood Special Education. It's kind of a different pace than we've had because you're really being proactive in this one. All the other chapters seem like we're looking at what is, and here you're trying to do things that are preventative to prevent things from happening, and some good evidence that it helps, a successful program and stuff. Really, it's about working with families, working with kids in natural settings to play, and I think if you really want to be in SPED, this would be a fun area to be in. Go through kind of quickly the thing, about a 45-minute lecture, but I hope it gives you some insight into early childhood special education. Chapter 14. Chapter 14, Early Childhood Special Education. Kind of a new thing in the field, newer than the others. And that it's this. Here's some questions. Why is it so difficult to measure the impact of early intervention? Hopefully you can hit that. How can we provide early intervention for a child whose disability is not yet present? Interesting that would be, because the other special ed is all about what is present. 4 different purposes of assessments. Which do you think most important goals of early childhood special ed? How can we play activities or everyday routines become especially designed for learning? And that's what this is about. Okay, here's the teacher. Come down here. Children learn a phenomenal amount from the moment they are born. And this is what they concentrate on in early childhood special ed, is those very early times. They grow and develop in orderly, predictable ways, learning to move around the world and communicate. Typical rates and patterns of child development contrast sharply with the progress of many children with disabilities. So that's what they're constantly comparing to, is developmental things, and that's what this is about. So how about the importance of this early intervention? Well, earlier it begins, the better, is the thought here. Burton White, who conducted years of research typically developing infants, preschoolers at Harvard Project, believes that the period between 8 months, I've never heard this before, and 3 years is critical. And I didn't know it was more critical than others, but that's what this is saying here, this Burton guy. To begin to look at a child's educational development when he is 2 is already too late. All right, and this, especially when it comes to reading, and I've told you this before, this is what the reading thing is based on, is this phenomenon right here. Reading to children as babies or even in uterine, based on this research here. First year's life are the most important of the children without disabilities. They are even more critical for the child with disabilities. With each passing month, risks falling farther behind. So what is early intervention? Now this is a little controversial, this term, and I try and sort this on the test a little bit, but there's 2 things they're looking at here. Early childhood, in the literature, the term early intervention refers to those infants and toddlers from birth to 2. Okay, that's what it says in the literature, but early childhood special education refers to educational related services provided from 3 to 5. So 2 different things here. This here is early intervention, early childhood intervention, birth to 2, and then early childhood special education is 3 to 5. So hopefully you can split those. And this whole thing from birth through 5 is really referred to as early intervention. But early, let me see if I have that right again. Early intervention is birth through 2, and early childhood special education is 3 to 5. Consists of comprehensive systems of therapies, educational, nutritional, and this is all here. Child care, family supports, all designed to reduce the effects of the disability or prevent them occurring. So let me take you out here to here. Again, the earlier the better. It's a comprehensive, and this is a word because you have to look at all, like we talked about special ed before. It always is comprehensive, more than one part. And this whole program, therapies, educational and nutritional, and this is for families, child care. And why that's in here, that may seem like an odd thing here, but when child disabilities, that's a huge thing to have child care to help take care of an infant or toddler that has disabilities. And of course family supports in that way, all designed to reduce the effects of those disabilities or prevent. And I say, and in childhood, in special ed, we don't really ever look at this one. Prevention, the occurrence of these developmental problems later. And how they try and predict what those are. And it goes on to this, does it work? Shows that comprehensive experimentally based early intervention enhances the development of young children who exhibit delays and helps this. Now these here, this is going to be number one for you, is I'm going to ask you just to put about 1 or 2 lines for each of these. And let's go to this here. Hundreds of studies have been conducted in the effort to answer the questions. We'll look at those, a few of those studies here. The 2 earliest examples, called first generation research. So first, Skeels and Dye, the earliest one of the most dramatic demonstrations of potential impact. This is interesting that he did this work in 1939 on this, found that with intense stimulation, one-on-one attention, and half morning kindergarten program with 1 to 2 year olds who have classified IQ, eventually independent, successful adults. So that's phenomenal, and it makes me a little suspicious. I'd love to see what kind of research he did, but this is phenomenal that he found this with this intervention. This Milwaukee project was to reduce this incidence of intellectual disabilities, and here they worked with the parents with infant and that had children with disabilities. Okay, and the children had to have IQs below 70. And why is 70 significant? If you remember, because that was the plus or minus for determining if the child had mental retardation or, as we call it now, intellectual disabilities. And the mothers received training in child care and were taught how to interact and stimulate their children through play. And that's still how this is run today, is through play, is these early childhood programs. And then this Obsidian project, longest running, carefully controlled, ever conducted in the United States experiment to test whether intellectual disabilities caused by psychological disadvantages could be prevented. That's what that was about. All right, so you'll want to pull those together. And this one, Infant Health and Development Program, has a nice acronym here. Intervention service to infants who were born prematurely, and that was their in. If they were premature babies, and that's still a risk factor. And low birth weights, 2 conditions place children at risk and developmentally. This large scale of 1,000 children and their families were in this study. And then you look through here and you come out with conclusions of that. And then the summary of this here, and that's those here, 1, 2, 3, 4. You'll fill in for those. Then the summary, and this numerous methodological problems make it difficult to conduct early intervention research in a scientifically sound manner. And that's, to be honest, that's all special ed and education. It's a little challenging to do that. Unlike medicine or stuff, among the problems are the wide disparity among children in the developmental effects of their disability, the tremendous variation across early intervention programs and curricular focus, teaching strategies, length and intensity, and ethical concerns. And this is the big one I want to hit on, is the ethical concerns of this. So think of this. We've got a new method of doing something or program that we think will really help kids, but we're going to withhold it from a certain group of kids in order to determine if it's successful or not. And that's always an ethical concern. And really, anytime you have research, that's it. We have a new drug that may save cancer patients that are really struggling, but we're going to withhold it from a group of patients to see if it works on these others. And so that's the same here. You can withhold something that may be successful just in the name of research. So that causes problems with research and any of these things. Most educators agree that, on a balance, the research evidence shows that comprehensive, experimentally based early intervention enhances development of young children who already exhibit these delays. Our national policymakers also believe that this is true, and that is a fancy term for our federal government. Citing research and testimony from families, and more on this testimony than on research from families, Congress identified the following outcomes for early interventions in the IDEA in 2004. And let me just tell you, IDEA, remember, this is every 7 years it gets reauthorized. So this was not the last time. The last time was 2011, but in 2004 It was the last time it was reauthorized. And so let me flip back here to what is the idea of this. Outcomes of this from an IDEA, there's IDEIA, Early Intervention, Individual Education and Early Intervention Act, enhance the development of infants and toddlers with disabilities, and reduce the educational cost to society by minimizing that need for special ed in the future and related services. Maximize the potential for individuals with disabilities to live independently in society, enhance the capability of families to meet the needs of their preschoolers. So this is really a family act, working with those families, because that's how overwhelming it could be when a child is born, especially if the effects of the disability are immediate, is when the families really need this. And then enhance the capability of state and local agencies to identify, evaluate, and meet the needs of those children. That's what that's about. That's how important it is. Let me go back here and make sure we have the rest of this. And those 5 things. So what is this? 75, Congress has enacted 5 bills reauthorizing and amending the original IDEA. The second of those bills was 99, PL 99-457, and been called the most important legislation ever enacted for young children with developmental delays. Now, I think that's a question on the test. Most important ever. But first, I want to go back here on this. I want to revisit this of 99-457. So tell me again what these stands for. What does PL stand for? What does 99 stand for? And what does 457 stand for? This is number 2 of your inputs. Tell me exactly what those numbers, those letters and numbers stand for. Not the law, what they stand for. But 99-457 mandated preschool services for children with disability ages 3 to 5. So this is early childhood special education, and provided a voluntary. So 99 says mandatory, mandated 3 to 5, and voluntary incentive grant program for early intervention services to infants and toddlers. So this was birth to 3. Grant, meaning we'll give you money if you'll do it. You have to do this, 3 to 5, as just we don't have to provide services to all kids 3 to 5 yet. But anybody that was determined to have a disability is entitled, just like they were once they're school age. And then they said to the states, and if you want to do this infant and toddler thing, 0 to 3, there's grant money. And grant is that code for federal government laundering money through them to the states. So that's what those 2 parts were. 99-457 was enacted. And I believe it was 86. I think we'll see a little bit later. IDEA mandates early intervention services for any child under 3 who has developmental delays or has a high probability of developmental delays. And then mandates preschool for children ages 3 to 5 that have disabilities. States that receive IDEA funds for early intervention must serve all, and this goes back to our 0 reject, infants and toddlers with developmental delays, establish the risk conditions. States may also serve infants and toddlers who are identified as a biological or environmental risk. Now let's look at what those are. This is quite a few. In 9 and 10, approximately 352,000 infants and toddlers were diagnosed nationally. That's a lot. A lot of little ones needing this service. Thus, the state receives IDEA funds to early intervention services must serve all that have developmental delays or are at risk. Each state may also, at its discretion, serve at-risk infants and toddlers who are at risk of experiencing these in the future. So what are these things, these documented risks that are biological and environmental? Well, here they are. It's called a developmental delay. Let me go back and show you what we're going to do with this. I'm going to ask you to make this number 3 and put 1 line for each of these. Developmental delay, establish risk conditions, biological risks, And here's what those are. A developmental delay are significant delays or atypical, not typical, pattern of development that make children eligible for early intervention. Each state's definition of developmental delay must be broad enough to include all disability categories covered by DEA. Okay, let me say it again. Broad enough to include all disability categories. You remember all of our disability categories? We've studied each one. Your definition has to be broad enough to do with that. But children who do not need to be classified or labeling according to those categories receive early intervention services. So if they don't fit any of these categories and they still have some problems, they can still be served under this category. So it does not need to be classified or labeled according to those categories to receive this. So if professionals deem they're still delayed without any of those categories, they get this. And then this one, established risk conditions include diagnosis of physical or medical conditions that most always result in this. Examples are Down syndrome, Fragile fetal alcohol syndrome, brain or spinal cord damage, and this. So without any assessments, when these are there are risk conditions automatically. And biological risk conditions include pediatric histories of current biological conditions like significant premature birth, low birth weight. These two are kickers that automatically kick this referral and assessment. And then environmental risk conditions include factors such as extreme poverty and parental substance abuse, homelessness, abuse or neglect, perinatal intellectual impairments, which are associated with higher than normal probability. So if those conditions, and these are the ones that are really politically incorrect to talk about, but I'm glad they recognize those as possibilities where this child automatically would qualify for these services. Okay. Now, how about this IFSP? IDEA requires that early intervention services for infants and toddlers be delivered according to an IFSP, Individualized Family Service Plan, developed by a multidisciplinary team. And there we had that term back in chapter 2, I believe, or 1, includes a child's parents and other family members that must include each of the following elements. Okay, so there's 8 statements here, and that's what I'm going to do. Ask you to make one line what these 8 are and make them short and sweet because they parallel what we did with IEP. And here are those 8. One, statements of their present level of performance. Only here it's present level of physical development. So present levels is what this is about. Number 2, a statement of the family's resources. Their resources, priorities, concerns relating to enhancing the development of the family's infant or toddler with a disability. Number 3, a statement of the measurable results. We have that on the IEP. What will they be able to do after this? What will that be? 4, a statement of the specific early intervention services. What services will they get? Then 5, a statement of natural environments, because this program is about serving them as much as possible, not in school settings, but in natural environments in which early intervention services will appropriately be provided, including a justification of the extent, if any, to which the services will not be in the environment. So, and natural environment, of course, for the most part, is at home. Number 6, projected dates and IEPs. It was all about the dates, too, for initiation and anticipation length, duration. 7, the identification of this coordinator. Who is the service coordinator? Who is going to be responsible? Okay, and then 8, any steps to be taken to support the transition. And in early childhood, it's all about transitioning this child to preschool or whatever other appropriate services are. So there's your 8. And then I want you to do this too. Tell about this. The IFSP differ from IEPs in several important ways. Unlike the IEP, the IFSP does these. And I have that over here. Tell how they are different. And here they are. Revolves around the family as a constant, most important factor in the child's life. defines the family as the recipient of early intervention services rather than the child alone. Family, not just the child. And focuses on the natural environments instead of what? Instead of school. And then the fourth one includes the interventions and service provided by a variety of health and human service agencies in addition to education. Where IEP, it's almost exclusively what the school's going to do. Here, who else are going to be the players in this? An IFSP must be evaluated once a year and reviewed with the family at 6 months intervals, and that's a difference also. Reviewed at 6 months intervals. All right. This is a little bit interesting too. It can be sooner than 6 months if the family requests. And what the thing is, kids change so fast at this age that on the IEP, of course, it was 1 year, and at this it'll be less. It'll be more often. And then two, allows early interventions to begin. They're allowed to begin with IFSP before the parents sign, unlike the IEP. And then in Figure 14.1, we'll look in a second, shows the portions of the ISP developed with and for the families of a 26-month-old child with disabilities. We'll look at that in a second. So then we go to this special education for preschoolers. Okay, so we had families, now this is special ed. And how is this different? Preschool children do not have to be identified under existing categories to receive services. Remember that here too. Remember the existing services like intellectual disabilities, emotional disturbance, orthopedic impairments. They may instead receive services under this category of developmentally delayed, meaning they're just delayed. We don't have a specific disability like on IEP, but they're just behind their age mates. Each state at its discretion may also serve children 3 to 9, and that's different also. That's different also, ages 3 to 9 under the developmental disability category. Normally think of school. So even after they start school, they could come into kindergarten. This is how you could get somebody coming into your kindergarten classroom that's already on an IEP. Because at age 3, we start to write IEPs as well as IFSPs. The IFSP may stop at that point and just have an IEP, but at that point, up till age 9, you can still receive special education services without having one of those categories that we've studied, without calling it a learning disability or intellectually disabled or emotionally disturbed or orthopedically impaired or something like that. You can still just be developmentally delayed. And then here, experiencing development delays as defined by state as measured appropriate diagnosis instruments, one or more of the following. Could be this: physical development, cognitive development, communication development, or social. I'm going to put this in there for you also. So we have this. So you have that. But if I want you to put this in here of what are these 4 things. Preschool children do not have to be identified as existing categories. Here's the second one. At their discretion can serve development delays 3 to 9. IEP for preschoolers must include a section with suggestions and information for parents. Has to have that on this. An LEA, local education agency, may elect to use a variety of service delivery options like home-based, center-based. Remember, the other one had to be natural settings. This here can be, they can choose their thing. And the state education agency must administer preschool special education programs, but it may contract services from other agencies to meet the requirements of full range. For example, many preschoolers with disabilities are served in community-based Head Start programs. So you can collaborate with others. An IEP, we can't do that. So there's the 5 things. And this was our, this is 3. This is our number 4. This is our number 4 here. So this will be your number 4 here. So this will be your number 4 here. And this will be your number 5. This will be your number 6. All right. Let's go on and look at screening, identification, and assessments. Well, there's this difference: screening, diagnosis, program planning, and evaluation. And of course, I'm going to want you to do this, so this will be your number 7. Just one line about each of those, and of course these. Number 8, about the APGAR scale, newborn blood test screening, developmental screening. So let's take a look at these. Identification at this age are conducted for at least 4 different purposes. Specific evaluation teach. First, screening. Quick, easy to administer test to identify children who may have a disability who should receive further testing. Second one, diagnosis, in-depth comprehensive assessment to all major areas of development to determine their eligibility. And then planning, program planning, curriculum-based criterion reference assessment to determine child's current skill level, remember the present level, and then identify whether an IFSEP or IEP objectives from that, and then plan those interventions. And the last, curriculum-based and criterion reference to determine progress. So those things are like the IEP that we're going to first screen and then diagnose and then plan and then evaluate. So what are these screening tools? For young children and their families, make sure I'm here. For young children and their families can be served, the children must be identified. Some children with disabilities are so significant that no test is needed. General rule for more severe disabilities, the earlier it is detected. In the delivery room, medical staff, okay, I want you to know this, this is where it starts. In the delivery room, medical staff and certain can identify this. This is how it starts. These referrals can be made by attending physicians at delivery. Can identify certain physical disabilities and health impairments such as microcephaly and cleft palate, both risk factors, as well as most instances of Down syndrome can be diagnosed at delivery. Within the first few weeks, other physical conditions such as paralysis, seizures, or rapidly increasing head size can signal possible disabilities. But most children who experience developmental delays are not identifiable by obvious physical characteristics or behavioral patterns, especially at very young ages. That's why you have to do screenings. So, at delivery, a doctor takes one glance and can see these severe physical disabilities. Other than that, it's a little tough. So they do, at birth, all children do have this APGAR scale. The APGAR scale, which measures the degree of asphyxia, this oxygen deprivation in an infant experiences during birth, is administered virtually all babies born in U.S. hospitals. The test administered, whether it's a nurse anesthetist, or a pediatrician, evaluate the newborn twice on 5 physiological measures. Here they are. Heart rate, this is what I want you to put in here. Heart rate, respiratory effort, response to stimulation, muscle tone, and skin color. The child is given a score 0, 1, or 2 on each measure according to the criteria described on the scoring form, and here it is. Heart rate, absent, 0. Okay, that's good. Okay, this is what it looks like. Respiratory effort, if it's apneic or lusty cry or breathing, just right through here. And my kids scored 8s on these. I'll tell you in a second, but I still had one that had a danger risk. The first administrative test, which is conducted 60 seconds after birth. Did you know that? So this is what it's given, 60 seconds, and then here it gives the scores of it. The next one, that's newborn blood test, is mandated in all states, but the components of the newborn vary from state to state. So this PKU, I think, is the one we do here. But that one, you want to bring that one in. And then this one, developmental screening test, be used from 2 to 6 years of age is another possibility. So those are all screening. Remember here are all these here. So let's look at diagnosis here for those. Yeah, those were all screening tools here. So here's diagnosis. Can be motor development, cognitive development, or communication language development is what you're diagnosing here. And again, we get to here now, we're beyond these severe disabilities. We're getting into more of this developmental delay. And so we want to diagnose where that is. So motor, cognitive, and communication are those here. And then social and emotional and adaptive development all here. So I'm going to ask you to make this one. This is your number 9. And that's just one, and number 10 down here, just one line for each of these, what these mean. Okay. Generally, these 5 areas are broken down into specific observable tasks and sequence developmentally. So like here you see the picture here on the side, you put some kind of thing and see what the child does. They reach for it, and then you see this diagnostician recording that. Here's the Bailey scales, can be used to diagnose developmental delays in children 2 to 30 months. So it gives you an idea what that. 2 widely used tests for diagnosing developmental delays are the Battelle Development Inventory and the Bailey Scales of Infant and Toddler Development. And so those are just for developmental delays, and it gives you that. Then Program Planning and Evaluation Tools takes you to this. A number of those things. Identify current levels of functioning. Remember the present levels. Then the goals and objectives. And determine appropriate interventions for those things. And then evaluate progress. Just what we looked at. All right. So what about instruction? Teaching this now. Support families in achieving their own goals. Let's look at that. Although the child with special ed needs undoubtedly are a focal point, a major function of early intervention is helping families achieve their goals, most important to them. Family functions as a system separating the child from the system results has fragmented outcomes. Okay. Promote child engagement, independence, mastery, maximum independence, development of all domains, support social competence, facilitate generalization of learned skills, prepare, assist children to typical life experiences with their families, help children and their families make smooth transitions. And minimize development of future problems or disabilities. So those things here, and I'm not going to make you put those all down here, but just that's the goals of this whole program. Is this mastery, independence? This is really helps you get ready for school in all the domains. Remember, the development is cognitive, motor, communications. Promote that development. Support social competence. Facilitate and generalize use of learned skills with typical life experiences of their families in school and their communities, help children and their families make smooth transitions into other schools and future problems with disabilities. And again, the range of this is interesting because as we talked about in this, as we started this, where is it fit on that spectrum? Is it very, this whole process is completely different for kids with severe disabilities and the kids with mild disabilities. So that's altogether different. So curriculum and instruction. Let's go look at this. Development appropriate practices. What are these? The DAPs, and there's going to be this around here. What is the DAP? Developmentally appropriate practice. That's one of those things you want to get in your vocabulary when working with young children, is the development appropriate practices. What are these things for optimal learning and development? DAP rests on core principles that early childhood educators should consider in their decision making. Knowledge must be informed decision making. Okay. I practice to promote this. And I'm going to make this. Let's see. This is number 11. Here is what are these core principles. Okay. So here's what that is. Practitioners must know about a child development and learning, about each child as an individual, and about the social and cultural context of this. And then the goals must be challenging and achievable. They are essential. No good teacher simply leaves them there. Learning and development are most likely to occur when new experiences build and the child already knows, is able to do this. You know, we say that in a regular classroom too. And then teaching must be intentional to be effective. Good teachers are intentional in everything they do, setting up the classroom, planning the curriculum, making use of various teaching strategies, and assessing children and interacting with them. When most of these children view the DAP guidelines as foundation of which they do, they also write generally designed instruction not necessary properly. Okay. So there's those. Selecting these goals and objectives should be evaluated according to the following 5 indicators: functionality, generality, instructional context, measurability, and this hierarchical relationship with the long range. So let's go find them. I jumped here too far. So selecting the IFSP, IEP goals and objectives. And this will be our number 12 here. And again, I say that to you just one line, and make sure you turn them all red so that I know where you're at, that you found them and did them. What is functionality? Increases the child's ability to interact with people and objects. And I found this. And there's a question on the test about functionality, what that is, and generality. Is the context the skill has generally, it represents a general concept opposed to particular tasks. Okay. And then here, instructional context, skill should be easily integrated into the child's daily routines and taught in a meaningful way. Remember, because we're going to do it in a natural setting or some kind of a setting that's more natural. Has to be measurable. Measurable if it's performance or a product produced, but importance can be seen, felt, and heard. Can be counted or timed. I heard one time that's what should be in the Olympics. Anything that can't be counted or timed shouldn't be. And hierarchical relation between long range and short terms are here. 14th row shows 11 questions that teachers can use to assess potential objectives. Let's see if we can find that right here. Here's the functionality, generality, instructional context, measurability, and here's the different questions they can ask. For example, functionality: will the skill increase the child's ability to interact with people and objects within the daily environment? That's how they would make that determination. So what are the instructional modifications? Let's look at it over here. The physical environment, materials, activities are often sufficient to support successful participation. But this is their big thing. Embed learning opportunities in the context of naturally occurring classroom activities. So this is the whole thing, that you're going to have play, you're going to have natural activities, but you're embedding learning opportunities in there. Preschool activity schedule include a balance of child-initiated and planned activities, large and small group activities, active and quiet times, indoor activities, and allow easy transition from activity to activity. So you don't have to constantly, what that looks like, and maybe it talks about that more. See, I worked in this a little bit. In one of my former lives, I subbed in an early childhood special ed classroom, and I got a healthy dose of some of this play with embedded activities in it. Let me just talk about it here. Embedded these learning activities in there. And I'm going to have you read this because some of this is on the test. This is embedding activities, this how to do it. Like water table at a variety of containers with spouts, plastic measuring cups, teapots, and stuff. What are you going to do? You're going to move through the center, modeling use of these activity materials and physical guidance for Alex as they do it. So it's just very interesting read here. And here's a preschool activity schedule they talked about. Supported physical environment. Organizations classroom into a number of different well-defined areas to accommodate different kinds of activities like quiet play, messy play, dramatic play, constructive play. Locate quiet activities together away from avenues of traffic and loud activities. What would that be, you think, quiet activities? Equip each area with abundant appropriate materials that are desirable. Locate materials that children can easily retrieve them. Quiet would be like reading, coloring type things. Needed for planned learned activities to play areas. The materials are accessible, safe boundaries, minimize distraction, environmental is enticing, exploring. And if you ever see one of these, it's like any preschool area. It's really enriching. But yeah, you got to have child-initiated and planned activities. What do they want to do? What can they come up with? So what are these service delivery alternatives here? Well, you have home-based or hospital-based programs. And that's for these low birth weight and other risk kids. Home-based. Require specialized health care. Home-based, built around family involvement and support. Center-based programs provides early interventions, special ed settings, and then combined home and center-based of those. Some advantages and disadvantages of both. And then center-based. And then combination of those. And families, most important of all, the families. Success of the efforts to prevent disabilities of children to identify and assess these as possible requires training, experience, cooperation, a wide range of professionals. Current best practice guidelines for early intervention, early childhood services call for transdisciplinary approach to the delivery of these services, which parents and professionals work together to assess the needs. All the people needed to make early intervention work, parents and families, are the most important. Enough information to support this before birth and certainly after. So one of the reasons that I was saying that my kids, my oldest one was almost 10 pounds, and that triggers automatically some screenings and stuff that for diabetes, I guess, when they're that big. So what's the rationale for parent involvement? Are most important in making early interventions work. Parents are most frequently and constant observers of their children's behavior. They know better than anyone else that their children need educators set realistic goals. They can monitor and report on their children's progress. And they contribute to their child's progress at every stage as minor teenagers, and you still develop a lot to theirs, contribute a lot to that. All right. I guess that's all. Chapter 14, Early Childhood Special Education.